Welcome to the Sunshine Training Center. Do burn patients really need to wear pressure garments all day, every day? Burn patients are usually instructed to wear pressure garments 23 hours each day for better scar control, removing them only for showering, wound care, or to avoid getting them dirty while eating. But garments can be uncomfortable, and strict adherence to the 23-hour rule isn't always feasible. How should therapists plan garment wear schedules? This video covers 3 important factors to consider. 4 tips, how-tos and videos on burn rehabilitation. Be sure to subscribe to our YouTube channel or visit our blog at www.sunshinetraining.org. This video was prepared by Yuli Sung, physical therapist and director of the Medical Device Center of Sunshine Foundation. What are the 3 factors to consider in regards to the 23 hours general rule for wearing pressure garments? They are the phase of scar maturation, the status of skin, and the age of the patient. Let's examine each one. First, phase of scar maturation. Scars form 6 weeks to 3 months after wound healing. In the active scar growth phase, collagen is deposited at a higher rate, in thick bands, in a whorl-like pattern with no overall orientation. This accumulation is what gives the scar its raised and rigid appearance. Early pressure therapy helps collagen realign and soften scars. This process can take 1 to 2 years or even longer. Early and continuous pressure therapy applies vertical pressure to the scar, encouraging collagen realignment, resulting in softer scars and speeding up the maturation process. In the active growth stage, 23-hour wear is recommended to counteract hypertrophic growth. But as scars mature, wear time can be progressively reduced until pressure garments are no longer needed. We'll discuss how to plan the progressive discontinued use of pressure garments in another video. Second, status of the skin. Recently healed scars are fragile and prone to blisters. While pressure therapy is important, fragile skin might not handle the friction from pressure garments. In these cases, other pressure therapy tools like elastic bandages or self-adherent elastic bandages like Coban can be used temporarily until the skin is more stable and able to tolerate pressure garments. Third, age of the patient. The 23 hours general rule applies if the scar is stable and is currently in its active hypertrophic growth phase, but adjustments are needed for young children. Research indicates that prolonged or excessive pressure may affect growing tissues like bones in children. Therefore, garments can be removed during breaks throughout the day. Breaks can be scheduled in a way to minimize disruption to the child's routine. For example, if the child takes a nap after lunch, garments can be removed before the child has his lunch and put back on after his nap. However, if scar hypertrophy is severe, wearing time should not be reduced too much. To avoid complications, garments should provide enough pressure to leave a slight indentation on the skin, but not be too tight. Monthly follow-ups are crucial to ensure that garments fit, scars are controlled, and the child's development is not affected. Special attention should be paid to key areas like the face, torso, limbs, and breast development in girls. Garments should be replaced every 6 months or sooner for fast-growing children. Remember, the 23-hour rule is a guideline, but it may need to be adjusted to the patient's situation in terms of scar maturation phase, skin status, and age. Thanks for watching, and don't forget to like, comment, and subscribe for more professional tips.